Welcome to YARKUD International. Let's see the Saudi Prometric exam question and answer one by one. First question. A 30 years old married female has dilatation and curettage as a therapeutic abortion. A nurse is preparing for discharge instruction. What should the nurse include in the discharge instruction? Okay. So you have to be remember always the option 4. We will be reading of all 4 options and you have to select the best answer because they will be 2 or 3 answers will be there correct only, but you have to select the best one. Okay. So here the option, take a high protein diet, use tampons while swimming, avoid sexual intercourse for 2 weeks, continue bed rest for the 2 weeks at home. Okay. So here what will be the important teaching here? Okay, we will be instructing the patient not to use touch. Okay. And we will be instructing the patient especially for avoiding sexual intercourse for 2 weeks. That is a very important thing you should be remember. Okay. So here the answer is avoid sexual intercourse for 2 weeks. Got the point? So let's see the next one. The nurse is placing an astrogastric tube in a patient for enteral nutrition. Which of the following action must the nurse consider before giving feeding to verify placement? Okay. So here the NG tube fixation. So then after that to verify the placement, what will be done? Here the question. So what is the options? Palpating the abdomen. If you palpate, you can able to see the nasogastric tube. No, it's wrong, right? And aspirating and testing the content. Yes, we can do it that. And C is placing the tube in saline to see the bubbles appearance. No, that is not to check the placement. D option, injecting air into the tube and waiting for the patient to burp. That is also wrong answer. So what will be the answer here? Aspirating. Okay, aspirating and testing the content. Usually we'll do the aspirating of the small amount of gastric content and we will just check for the pH and we will be observe the color of the content. Okay, that will be the placement checking. So here the answer is B, aspirating and testing the content. Okay, got the point? Next question, a 45 years old patient was admitted to the medical ward with confirmed cases of meningococcal infection. Which of the following infection control prevention should the nurse implement? Okay, so here you have to remember meningococcal patient, which precaution you will take? Droplets or contact or airborne or standard precaution. Okay, so this is the question. So here you have to remember meningococcal infection. It will be spread the person to person by the respiratory droplet. Okay, remember it will be important meningococcal. Just write it down the key point. It will be transmitted to person by the respiratory droplet. Okay, and what we will do if it is identified meningococcal infection, immediately we have to put the patient isolated room. Okay, private isolated room, and we have to be do the droplet precaution. Immediately we will start the antibiotic also. Okay, so what precaution we will take here? Droplet precaution. Got the point? Okay, let's see the next one. Which type of isolation precaution is necessary for the patient with the methicillin-resistant Staphylococcus aureus? That is the MRSA. Okay, commonly in the hospital setup, there is a common infection called MRSA. So it is very dangerous because all the drugs are resistant. Okay, so here you have to remember it will be spread by direct contact. Okay, direct contact, often people hands will be contaminated. That will cause the patient, if the medical person treating one patient and not doing the hand washing properly and going to the next patient and giving care, that will cause the MRSA. Okay, mainly hospital setup. So here MRSA will be spread through the bedding, towel, clothing, equipment, and especially for the hands. Okay, so what precaution you will take? You will take contact precaution. Okay, so these are the important questions. Remember and write it down the key points. Okay, contact precaution will do the MRSA infection. Okay, got the point? Let's see the next one. Head nurse of an intensive care unit wrote a report about the needs of her department and gave it to the nursing supervisor. Which of the following types of communication is this? Okay, here they are asking the communication. Mainly we have upward communication and the downward communication. Okay, so upward, I will tell you, whatever the, when we have the hierarchy of the communication, whatever the lowest position person giving instruction to upward person. Okay, so the lower responsibility person giving the response to the upward person, it will be considered as a upward communication. From the upward, I will tell you the example. If the HOD, okay, HOD is the nurse manager, is the nurse manager is handing over the report to HOD, that is called upward communication. But if it is HOD is handing over to the something, telling instruction to the nurse manager, it is called downward communication. Okay, got the point? You don't confuse. If it is the higher authority person giving to the lower authority person some instruction, it will call higher to lower, it is called downward. It is lower to higher, it is called upward. Okay, so just here we will see the example, then you will understand. Here the nursing supervisor, okay, with here they are, the head nurse is an intensive care unit, wrote the report about the need of her department and gave it to the nursing supervisor. That means head nurse is giving to nursing supervisor, okay, NS. So it will be what communication? Upward. She is going to the higher than her responsibility person and giving to the report. So that is come under upward. If the head nurse is going and communicating with the some of the nurse, okay, staff nurse, it is come under the downward. Got the point? So this is important. So you have to be remember this communication question. Okay. So here the answer is upward. Okay, so these are the important Saudi Promotric exam questions. Here the YARKUD International, we are giving the online training for all nursing examination like Promotric, SNP, MOH, Omen Pearson View nursing examination, DHA, HAD, OET and IELTS.